today. And I need to do an assessment.
Okay.
I'm going to listen to your lungs first. Can you take a deep breath? Need to get under here. Last one. Have you been short of breath?
Yeah, it just feels like I can't catch a full breath. It's just really hard to breathe.
Well, your lungs have some crackles in there. It sounds like you got some fluid and your feet are pretty swollen.
I don't think they were yesterday.
You weren't swollen yesterday?
Not that I remember.
All right, well, I'm going to go call the doctor for you, okay?
Okay, thank you.
You're welcome. Hey, Clara. I got off the phone with the doctor and he started you on a diuretic. It's called Lasix.
Oh, okay.
And it's going to go through your IV, okay?
Okay.
Have you ever had a diuretic before?
I don't think so. What is that?
Well, it's also known as a water pill. And it's going to pull off all that extra fluid that you've got.
Oh, that'll be good. Will I take this at home, or is this something in the hospital only, or?
Well, here in the hospital, we're going to give this to you through your IV. But at home, you'll take a pill just once a day.
That sounds expensive. How much is that going to cost me?
It's actually fairly cheap. It's between $7 and $10 for 100 tablets.
I think I can afford that.
Now,
Hopefully this helps.
Yeah, it's going to make you pee a lot, and it can make you pretty dizzy. So I'm going to need you to call when you need to go to the bathroom.
Oh, okay. I will.
Do you have any other questions for me?
Not that I can think of. I'll let you know, though.
Okay.
As you saw in this video, a diuretic is a medication given to decrease excess fluid and blood pressure in the body. The action of a diuretic is to enhance the selective excretion of various electrolytes and water by affecting renal mechanisms for tubular secretion and reabsorption. There are 4 types of diuretics: loop, potassium sparing, thiazide, and osmotic.
Loop diuretics cause the kidneys to excrete urine by lowering the amount of water in the body as well as the blood pressure. An example of a loop diuretic is furosemide, also known as Lasix. For edema, the common dose is between 20 and 80 milligrams. For hypertension, 40 milligrams BID. Potassium-sparing diuretic reduce amount of water in the body, but do not cause potassium to be excreted. An example is spironolactone, also known as aldactone. The dosage between 25 and 100 milligrams. Thiazides. They reduce the amount of salt and water in the body, usually the first drug given to treat high blood pressure. Hydrochlorothiazide, also known as microzide, is an example of a thiazide diuretic. It is commonly given in dosages between 12.5 to 100 milligrams daily. Osmotics. They increase blood flow to the kidneys by expanding fluid and plasma volume. Mannitol, also known as osmotrol, is given in 50 to 100 milligram doses by IV only.
Diuretics are relatively cheap medications, usually ranging from around $7 to $10 for a 100-day supply. Diuretics can be given either IM, IV, or orally, but IM is not usually recommended. Common side effects for diuretics include dizziness, drowsiness, fatigue, hypotension, blurred vision, headache, tinnitus, hearing loss, anorexia, constipation, diarrhea, dry mouth, nausea, excess urination, photosensitivity, hyperglycemia, muscle cramps, and fever.
Nursing implications include monitor daily weights, monitor blood pressure and pulse, monitor electrolyte, renal, and hepatic functions, should be taken with food or milk to decrease GI upset, administer undiluted, and do not exceed 4 milligrams per minute, monitor neurologic status, monitor for tinnitus or eye pain.
Patient teaching. Instruct your patient to take the medication as prescribed. If a dose is missed, take it as soon as they remember. Contact their health provider if they have a weight gain of over 3 pounds daily. Wear sunscreen when outdoors because of the risk for photosensitivity. Change positions slowly because it can cause a drop in blood pressure. The importance for routines follow-ups, and if taking a single dose, take it in the early morning and if taking multiple doses, take it before 5 p.m. to eliminate sleep disturbances.
Patient advantages and benefits: decreased in edema, decreased weight, increased urinary output, and decreased blood pressure.